issues that my friends and I are all going through, and it's being dismissed.
Women in their 40s, 50s who have been like, I went to my doctor and they threw me a starter pack and said, hey, try this. Or another patient said she called her doctor and was telling her symptoms. They're like, yeah, you're 43, that's how you should feel. Like,
that's normal.
So basically, now there's been studies that's like, that's actually not true at all.
Yes.
So it's found that starting hormone therapy in perimenopause, because as you get older and your estrogen levels decrease, which causes menopause, you have increased risk of heart attack because estrogen is actually cardioprotective. So that's why women, once they go through menopause, have a much higher risk of heart disease. Yeah. And so by going on hormone therapy, you actually can prevent cardiovascular disease, prevent osteoporosis, actually prevent some cancers. Like it's kind of amazing. And people have just been told, oh yeah, you're perimenopausal. That's how you're supposed to feel.
Exactly.
Another like really alarming thing is that when people go through perimenopause and menopause, like their rates of depression and suicide actually skyrocket.
A lack of like motivation or a lack of wanting to be like social can be perimenopause.
You start to feel like crap.
I mean, not like in depth, but one of the things she did share with me was painful sex.
We've had these high levels over time, and as they start to go down, you start to see signs of like decreased libido, right? So women aren't as lubricated as they used to. And then unfortunately, there's a mental game that so if we can kind of address it up front and kind of give those treatments, and the treatments can also be local treatments, right? And unfortunately, a lot of women don't talk about this. Like a lot of women wouldn't share, my libido's so down, or, I'm very uncomfortable when I'm having sex. And that's a shame, right? Because then those symptoms aren't addressed. And the likelihood is your friend might be feeling the same way. We can fix this.
And it's like scary to talk about, but it's so common. So if you're listening out there and you are experiencing that, talk to somebody about it, because you're not alone.